And let's dive into the contents of your book. However you want to introduce us to some of the concepts to help us understand how lipids work inside the body. The title of your book, obviously, the home security system and the lipid neighborhood, is an interesting way to think of things. So can you tell us how the nexus of your book kind of found its way to you and how you explain some of these concepts?
Sure. And so, what I always start off with is for everyone who does not want to have heart attacks, strokes, and down the line dementia, I want you to have a great home security system and I want you to live in a safe lipid neighborhood. Your home security system has four basic pillars: normal blood pressure, normal blood sugar, keep inflammation low, and don't smoke or do drugs because those are bad. But then your lipid neighborhood is your cholesterol panel because every ApoB containing lipoprotein, the vast majority of those being LDL particles, are potentially criminals that can infiltrate your arterial abode. And the Lp(a) particles, if you pick the wrong parents with that genetic risk factor, those are the felons. Because per particle, they're about 6.5 times as likely to cause mischief than your run-of-the-mill LDL particle. And so can always look at the four pillars of your home security system. We can check your parameters of glucose metabolism. And it's not just blood sugar, it's really insulin and blood sugar. Control your insulin, control your life is one of my mantras. But really, we can look at your parameters of glucose metabolism. We can look at your blood pressure. We can look at measures of systemic inflammation. If you're doing drugs, you should probably stop. And so those are axioms. No matter what your lipid neighborhood's looking like, these are constants. Nobody ever wakes up and says, I wish I had uncontrolled blood pressure today, or my 2025 New Year's resolution is I want to be more insulin resistant. Life is not better inflamed than non-inflamed. And then guess what? Doing meth is still bad. So anyway, so all these things are axioms, so we can agree on these four pillars no matter what. But then the lipid neighborhood, well, it might look on paper like you're living in a rough inner city neighborhood just on your cholesterol panel, right? But people don't live on paper, do they? And so do we have better ways that can inform our decision-making process with your lipid neighborhood? Well, one of my catchphrases is got plaque, get a CAC. What's a CAC? It's a coronary artery calcium score. And I call it the colonoscopy of the heart without the nasty pregame show. Because anybody who's done the bowel prep for a colonoscopy knows that will temporarily ruin your social life and probably destroy your bathroom also. So, but this CAC, you lay down, it's a low-dose CT scan, about the same amount of radiation as a mammogram, so virtually nothing. And it tells you if you have calcified plaque in your coronary arteries or if you don't. And if you do, you've been broken into. And you cannot have atherosclerosis without one of these ApoB containing lipoproteins going rogue. It's like a mailman going rogue, one of these LDL particles. And so you can't have atherosclerosis without one of those guys in the wrong place at the wrong time. And then it's the maladaptive immune response that results that gives you coronary plaque. So if you have a positive calcium score, if you have any evidence of break-in to your lipid neighborhood, well, you're living in a lipid neighborhood that's a little bit too rough. And so do you want to keep living in that same lipid neighborhood where you got broken into? Or do you want to maybe consider moving to a nice, safe, gated community with fewer lipid criminals if there's been evidence of a break-in? I think that's reasonable. And then we unpack how we can do that and some of the tools in our toolbox that can help you getting to live in a safer lipid neighborhood, to help shift the paradigm from reactionary to preventive, because all too often we just wait around for people to get worse when it comes to not only heart disease, but insulin resistance too. And that's one of my big deals. Chapter 1 of my book is all about control your insulin, control your life. That's one of my mantras. And because really, it's not just about keeping blood sugar normal, it's about keeping insulin levels normal as well, because hyperinsulinemia with or without hyperglycemia drives a lot of chronic diseases. And one of the problems too is, when you're insulin resistant, well, that means that your cellular mailboxes are getting full. And if the mailman, which are these ApoB containing lipoproteins, which their job is to just deliver triglycerides, a few phospholipids, some fat soluble vitamins to target tissues and then go home at the end of the day. If your mailboxes are full though, and the mailman are going to try to deliver mail in your mailboxes, well, what's going to happen? They're going to keep driving around. And if they're not delivering the mail and they're not going home at the end of the day, they're more likely to run their trucks in your arterial wall. And so insulin resistance is no good. And keeping, blood sugars and parameters of glucose metabolism optimal is essential for so many different reasons. And really what we do is we wait around. It's like, oh, you're pre-diabetic. Well, let's wait around for you to have type 2 diabetes. Then we'll do something about it. And quite frankly, insulin resistance and impaired fasting glucose and prediabetes and diabetes, it's all in the same continuum. It's like being almost pregnant. You are, you aren't, just how far you are along that process. And with coronary disease, if you have any plaque, you've been broken into. So do we want to wait around for that plaque to rupture and you be 100% occluded, which that's how majority of cardiovascular events happen. It's not this, progressive stenosis, where you have a little plaque and then you get a little more, and then it's progressively narrowing. No, 2/3 of heart attacks occur in when there's a little bit of plaque there and it's vulnerable, and then it ruptures, and then bam, you're 100% occluded and having the big one. And so if we can do things to mitigate insulin resistance, if we can do things to get ahead of the game when it comes to coronary disease, and if you have any plaque, I'd prefer that plaque stable, and we do have ways to stabilize that plaque and even regress that plaque potentially, then we should do that. And so really that's a lot of the book is really starting out with that home security system and that lipid neighborhood framework. And you can always, that's ground zero, because some of the stuff gets really complicated, and when we start talking about, some of the nuances of cholesterol homeostasis, your head can start spinning a little bit, but it's like, hey, that's okay. Just get back that home security system and lipid neighborhood. Got plaque, get a CAC. Oh, okay, we're good. Because most people that doesn't get quite overwhelming, and that's where we go from there.